Evening. This is Dr. John Bennett broadcasting from Miami. This is one in the continuing series of Boston Medical TV. Tonight, we have the pleasure of having Sean Orr, MD, a neurologist from Jacksonville. His topic tonight is going to be the neuroeconomy, and he'll explain exactly what that is. Also joining us tonight is John Hewitt, a medical writer from Philadelphia, and Young Kim, an ENT surgeon from Seoul, Korea. So good evening, gentlemen. John, could you just introduce yourself and before I introduce Sean?
Yeah, sure. I'm currently a medical writer with a background in engineering and neuroscience, and just help John out on his Hangouts, pop in and ask some questions, so happy to be here.
Okay, welcome, John. Can you hear me, Well, we may have lost And introduce Sean. Okay, Sean, it's all yours.
Great. Well, thanks very much, John. I appreciate the opportunity to be here tonight. I'm a neurologist in clinical practice, and I also work with a medical device company named Orr Md Medical, and we have my feet in quite a few different camps. Really appreciate the opportunity to talk to you tonight about a passion of mine, which is the neuroeconomy. And I think I'm going to go ahead and dial up a presentation here that I've made that I think might help get the idea across. I'm going to zip through it, though, because I know we don't have a lot of time.
Okay.
But I think it kind of gets across the idea of what I'm seeing happen out here in the field, and also at higher levels in the neurosciences. The argument that I'm making now is that we've entered a new era that we arguably can call the neuroeconomy, and that this new environment is creating all sorts of interesting new demands on society. Arguably, the medical complex is not meeting the needs of our society, and we're seeing this interesting do-it-yourself neurotherapy that's starting to grow out there. And really, the question is what is the role of the neuroscientist, the neurologist, and how do we help society enter this neuroeconomy? So the neuroeconomy is creating new demand, and I think of the neuroeconomy as the cumulative culture, wealth, and resources of a country or a group of countries as determined by the function of enhanced human nervous systems. It's really basically we're talking about a shift from the traditional heart-centered or brawn-based economies to brain-based wealth multipliers. So what does this mean? Basically, for all of human history, economies have really been driven by horsepower, by how much could be lifted, moved, transformed, and it was a really very heart-centered, horsepower-centered environment. And as of about 2012, we've finally shifted to a place where economic productivity is more dependent than ever on brain power. And we see this it's represented in many different ways: the knowledge revolution, the evolution of cloud-based technologies and the internet, etc. But really what it comes down to is the recognition that decision-making depends on brain function. So the ability to process multiple alternatives is kind of the definition of intelligence, the ability to choose an optimal course of action. All of this comes down to neuroeconomics, and our neuroeconomy is the financial result of the collective activities of many people who are making decisions on a level that we never could have happened before. So if you follow folks like Ray Kurzweil, who talks about the law of accelerating returns, and John, I'll just ask you, can you see my screen here?
Yeah, yes, it's excellent.
Okay, so you'll see a diagram that I took from one of his books here to credit him appropriately, and this diagram does a very good job of showing how we have this exponential growth in computing processing power, and he's predicted that out to about the year 2023 we should see computers that are commoditized, essentially available on the market for just about anybody to purchase, that will have the capacity, the human capacity to process like a human brain does. So on the teraflop level. And this is a controversial topic because Ray Kurzweil kind of goes into a lot of areas in terms of uploading the brains into the internet and such, and there's so much tied into this idea of robots taking over and such. So I don't try to get into that, but I think the point that this makes here is that there is this rapid transition that's taking place from regular humans to augmented humans. And as a neurologist, I see this on the front line all the time. Prescribe medications to help augment the cognitive capacity, and I work with people who've had bionic implants who are essentially cyborgs, who are now augmented. And I think that, so I'm in a really interesting place to see where the neuroeconomy is taking us. There are a variety of factors that are evolving at the same time. So one of them is the evolution of the exocortex. There's this exponential growth in lifespan that we're seeing, the concept of vulnerable authenticity, and the idea of the abundance mindset, which I'll talk about a bit here. But just breaking them down, the exocortex is, to really make it simple, is your cognitive processing power put out there in the cloud. So until the evolution of smartphones and computers and cloud-based technologies, everything that you had to remember, you stored it in your brain or you wrote it down on some paper somewhere, right? And if you think back to even Da Vinci, one of the things that made Leonardo da Vinci so brilliant was that he kept all of his ideas externalized in notepads, copious notepads. Scientists have done this over the years, over the centuries. So the idea of externalizing our thoughts and memorializing them is not a new idea at all. But what's happened is that the technology has taken off in a way that it's allowing us to extend our cognitive capacity like never before in such a vast externalized repository. So basically human intelligence is moving into the internet. We can make the argument that the internet itself is becoming intelligent. We're seeing this exponential growth in the number of computers that are available worldwide. So far, society has spent almost $5 trillion on computers since they first came into being. And we've seen just this explosion of technological memes that are out there in the cloud as we're entering an accelerated stage of evolution. So I think the point here is that as the exocortex is evolving and we're transitioning into this neuroeconomy, your wealth and your value in society are determined by your thinking ability. And as there's this convergence of human and machine intelligence taking place, it also implies that there's a certain vulnerability that we all have. And I would say that it goes beyond the vulnerability of privacy, which is obviously a huge concern, but also the vulnerability of the integrity of your data. So what will happen when you start to upload massive amounts of your memories into the web and then you lose that connection? I think we're going to see patients developing a new kind of dementia as we progress down this road. If you've lost contact with your exocortex, that really is essentially a dementing process. We have evidence of the exocortex and of cybernetics developing now. Medtronic has put more than 100,000 deep brain stimulators in patients. NeuroPace is on a rapid track to catch up. This is a very interesting product that listens to brain waves and will actually intervene to interrupt a seizure as it's developing. So this is a bidirectional brain-computer interface. The DARPA put out a request for proposal in November of last year where they're proposing a $70 million grant over 5 years to put brain implants into veterans and actually active infantry who have PTSD. And the goal here is to actually interfere with brain signals that are counterproductive. So if a veteran has a PTSD flashback moment, somebody sitting at central control can monitor this and send a signal to their brain that helps to improve their cognitive function. So it has all sorts of dark overtones like Skynet from the Terminator. At the same time, there could be a lot of benefit that's given to humanity. So as the exocortex is building, the questions are, how is the neuroeconomy affecting us here? How do young people start to incorporate the exocortex into their life more than ever? The young people are very open and willing to post just about anything on the internet, on Facebook. We're seeing the development of neuromarketing becoming much more prevalent. And I think neuromarketing will affect these folks more than ever as a maybe susceptible group of people. neuromarketing is essentially a new field of marketing research and action that uses biometrics, functional MRI, EEG to evaluate people's response to sales marketing material. And the awareness of neuromarketing is taking off quite aggressively. We're finding that you know, NIH and INDS have gotten into this at a high level, and we really understand now that certain concepts such as self-agency, social values, localized to certain parts of the brain. I won't go through this in great detail because there's no faster way to lose an audience after dinner than talk about neuroanatomy. But quick takeaway is that basically, you know, certain social values that we have localized to different parts of the brain, pride and gratitude, you know, social values, etc. So it turns out that neuromarketers are able to take advantage of some of this information as it's being mapped to start to stimulate them and trigger them in a way that's able to increase sales conversions. It's very innovative, it's exciting, and we're seeing new technologies that are evolving to be able to look at the brain in different ways. And I think this is all just a representation of what the neuroeconomy is doing to us. It's putting us into a position to be trying to optimize our brain more than we ever have before. So you see this growing awareness in many different ways. I tend to use this graphic here to decide what part of the spectrum I'm going to be taking care of somebody. So on the left-hand side of this graph are the acute stages. So if a patient presents with an acute stroke or some other form of acute brain injury, you know, I shift into the rescue mode and then try to repair that brain acutely. So in that setting, we're trying to break cycles that are undesirable, cycles of brain injury, brain inflammation, brain damage, and ideally move patients towards the right-hand side of the spectrum where we're then protecting their brain, ideally optimizing it, and then enhancing brain function. And so the idea here is that there really is a spectrum of actions that we're going through. Neuroenhancement is getting a lot of attention these days, and this is where we're talking about augmenting brain function so that it exceeds its design standards. And you know, again, there's a continuum of ethical consideration here. Neuroaugmentation has taken on, again, kind of dark overtones. If you just review the ethics of neuroaugmentation, you can think of the things that, as a medical doctor, I'm obligated to do, the things I'm prohibited from doing, and then the things I'm permitted to do but not prohibited or obligated. So obligations would be if a patient comes in with an acute stroke, I'm going to give them clot-busting drugs in the emergency department because that's my obligation. I'm on task to take care of that patient. I am prohibited from using my knowledge to torture patients. It's not considered ethical to use neurological means to inflict torture and pain. I am permitted ethically to engage in the practice of adult neuroenhancement with my patients, and there is a demand for this in the market. So when you think about neuroenhancement as the augmentation of brain function so that you exceed design standards, it meets bioethical principles where we're respecting patient autonomy, we're being beneficent, we're not being maleficent, and again, this applies to the adult. I think there's pretty good ethical grounds to say that it's not right to augment normal children. We can talk about that. But I would make the argument that our medical complex is not meeting the needs of the neuroeconomy or patients who want to augment their own brains. And we're seeing this just on the rescue side of the equation. And so there's this increasing demand of services, right? Patients with Alzheimer's disease, with stroke, traumatic brain injury, Parkinson's disease, multiple sclerosis. We're seeing this rapid escalation. I might also add autism in there as well. But the supply of skilled neurologists to take care of these folks is dwindling, and so there's this big treatment gap that's taking place. And this is all taking place at the same time that the medical system in the United States is deflating. Arguably, our system is unsustainable. Outcomes are not what they should be, and value has not until now been a part of the equation in the medical complex. So it's a very interesting confluence of times, of forces. It's an interesting time where we're seeing massive societal change that's really more than anybody can perceive today. And this is where I think a lot of people are trying to fill in the gaps themselves with do-it-yourself technology. And they're engaging in their own neurotherapy, and you're seeing a lot of technological shamanism that's on the rise. So what does that mean? Essentially, there's this interesting movement called biohacking that's developing. So it's do-it-yourself neurotherapy. Biohackers tend, in my experience, to be CEOs or entrepreneurs, very high performers, highly successful folks. So building on the idea that natural stimulants such as caffeine can increase your cognitive ability, they're on the hunt for new cognitive enhancers that will help them to perform better in the neuroeconomy. Nootropics, other supplements, hardcore exercises, hacking their sleep cycles, and actually even using different devices is becoming very popular. So you see on the left-hand side of this screen here, there's an FDA-approved device. Transcranial magnetic stimulation is being shown using scientific investigation to be actually a very useful, non-invasive way for improving cognitive abilities, reducing instances of depression and other mental illness. And it's a very safe way of doing things when used in the proper skilled hands. On the right-hand side of your screen, you'll see a device that's making the rounds, which is transcranial direct current stimulation. This is also a modality that's under quite a bit of investigation now, excuse me, but it's not something that's currently FDA regulated. And there's a large population of young people who are what we call gamers, right? They're playing video games, are very involved in that community, or young executives and entrepreneurs who want to improve their frontal lobe function, who are using mocked up versions of TDCS, and outcomes aren't always great. If you troll through the community, you'll find that there are a lot of folks who have zapped their brains into submission and have actually had decreased cognitive function as an example, as a consequence. So like many tools, there's an upside and a downside. There are some other interesting devices that are coming onto the market, human cephalography. Emotive makes a very interesting brain-computer interface that uses EEG to drive the ability to externalize your thought process and function. There's other techniques that we're seeing that improve cognitive function, such as hyperbaric therapy, hypobaric therapy, being marketed to improve brain function for the autism crowd or for high-performance athletes. So a lot of interesting stuff going on out there in the neurotropic drug world as well, and it begs a question as a neuroscientist: how do I stay relevant in this arena? How do neuroscientists continue to stay relevant when there's this growing mismatch in a biohacking community? And I think we're going to see some changes taking place in medicine. John, a lot of what you're doing right now with bringing the idea of Google Chats online, I think it's a natural evolution that we're going to see super user doctors who, instead of engaging in one-to-one relationships, now can influence thousands and millions of patients in a very useful way. We're going to see large systems of standardized automation developing out there, and super user doctors don't necessarily equate to celebrity doctors, although these docs have a lot of influence at the same time. But I think the idea is that we're going to have this massive ability to extend our knowledge very widely, and by providing context through our patients through automation and such, eventually can have individualization and fine-tune one-to-one care, but people out there, I think, are going to be in charge of it. We're seeing some of that automation take place right now in large hospital systems, for better or for worse. A lot of it is protocol-driven. The idea is that safety has to come first. There has to be value and good outcomes as part of it. You're also seeing do-it-yourself care, the garage medicine kind of approach. And then I think you're going to see some replacements, right? So the leveraged exocortex. I'm sure a lot of you saw Watson in Valentine's Day 2011 when Watson debuted against the two reigning Jeopardy champions and just mopped the floor with them. Well, I can't wait to have a Watson in my pocket so that I can even that much better at diagnosing my patients. I think take-home message there is that as we're entering the neuroeconomy, John, we're getting to this time in life when we're going to be seeing massive society. We're already seeing massive societal changes. We're seeing this rapid escalation of activities that are geared at augmenting brain function. A lot of it's being done by people on their own who now have access to information that they never did before because of the internet. And there are communities that are developing around this very concept. I think it's a simple, natural evolution that people are stepping up to the demands that are being placed on them in order to stay relevant, in order to stay productive. So do I have any real guidance for people out there? I guess the guidance I can give is, be aware that we're evolving into this new economic platform, the neuroeconomy. Be aware that the demands that are placed on you can cause you to make decisions that put you into a stage of burnout if you're not careful. And with the right kind of programmatic approach, you can actually augment your cognitive capacity, but if it's not done in a very well-informed fashion, it can actually backfire and have bad repercussions for you. So stay tuned. I think you're going to see a lot more in this environment evolve over the next 5 to 10 years.
Well, Sean, thank you very much. John, do you have some questions? I'm sure you do.
Yeah, sure. Yeah, in particular with regard to the DIY community you mentioned, you're talking about obligations, permissions, prohibitions from your end. On the DIY end, one thing they need access to, practically speaking, for legal purposes, is anesthesia. They can't get that without a medical contact too easily. But from your end, if they ask you to put in a custom cochlear implant, if they don't qualify because they're not totally deaf but nonetheless want one, you're not, at least to my understanding, permitted to put an unapproved device in a patient, or are you? Or an approved device for an off-label use. So I'm just wondering how somebody would handle that if they're approached by somebody in DIY community that wanted to really do something serious like that.
That's a very good question, John. To be honest, I hadn't really even thought about the DIY community embracing, high-level bionics like a cochlear implant. I've read stories of some DIYers who have actually implanted certain devices under their fingertips, for example. There's a group out in Arizona that was testing a ferromagnetic film that they were slipping themselves underneath their fingerprints, and it would give actually a tactile sense when electromagnetic radiation was encountered. So they could essentially sweep a room for bugs and feel if there were bugs present in the environment. That's the most aggressive kind of surgical augmentation that I've read about so far in the DIY community. I think most of it has been centered around external devices that they procure, such as a transcranial direct current stimulator, or drugs that they buy either through the black market or diverted drugs, or allowable supplements such as neurotropics and pharmaceuticals, nutraceuticals. If it comes to something like a cochlear implant or an implantable CSF monitor, as you kind of alluded to earlier when we were warming up our conversation, I mean, there is a black market out there for surgical procedures. For better or for worse, I would say for worse, a black market exists. I mean, the reason we have regulation for medical procedures is to protect the public and to guard against bad outcomes. And that's all based on the premise that highly skilled surgeons go through many years of training, and there's peer review and feedback, so that if a surgeon who's having bad outcomes doesn't go off the reservation too far, he's reined in by his colleagues.
Yeah.
Now, can some devices be used off-label? Sure. The FDA gives us leeway for medications and for devices to be used off-label. I guess an enterprising surgeon who develops his own database could potentially work with a community. So what kind of community do you think would use cochlear implants when they don't necessarily have deafness?
Well, somebody that is losing their hearing, maybe an elderly person. I'm thinking of, like, say, I heard a story of a person in England who, once they found out that after their grandmother died, the implant becomes the property of the estate. They had the implant and they put it in their pet. So now we're into a veterinary scenario, and spinal stimulators, facial nerve stimulators are right around the corner. Somebody's going to be wanting one of them for their pet. Then it's all of a sudden theirs. You can see where this can lead with a little imagination. It's not too far away.
Well, Sean, is there a black market for people, doctors implanting devices into brains in other countries?
I honestly don't know, John. I mean, I think if you think about it from a certain perspective, the devices that are out there are not commoditized. They're not made in bulk, at least not to the tune of millions, right?
Okay.
And every one of these patients, largely, if they're getting a deep brain stimulator for Parkinson's disease, for example, they're tracked carefully.
Right.
And their devices, the data is actually uploadable over the internet so that the doctors can track their outcomes. Can somebody make a knockoff? Sure. I mean, there's certain parts of the world that are notorious for retro-engineering things and making knockoffs. I am not aware to this date of a serious black market for knockoff devices.
Right.
But you can see a time not too far from now when that may become a reality. I think it's possible that it may come to that. I think the bigger black market is for pills. Medications that augment cognitive capacity that are used for other things.
The devices you talked about improving the exocortex, transcranial magnetic stimulator, and transcranial direct stimulation. Do you have any experience with that yourself, using it?
I do have experience with transcranial magnetic stimulation, and I've found that it's.
What's your feedback about that? I know there's probably not studies, but have you seen good results with it? Or haven't seen much effect? Or?
Oh no, there are actually very good studies. There are, probably up to 60 studies out there that look at transcranial magnetic stimulation in various different forms. There are, I'm aware of 6 clinical trials that have used TMS, as we call it, in the case of depression. And as a non-invasive, non-pharmacological, non-psychiatric treatment for depression, it's actually has very good outcomes, at least as good as medication, if not better, in the studies that have been reported. So it's a very interesting innovation and certainly worthy of development. In terms of transcranial direct current stimulation, I don't have personal experience with it. I have secondhand experience with a friend who's a neuroscientist who's actually a biohacker himself. So, and he's been very excited about it. Again, there actually is quite a bit of scientific information that there have been many studies over the last 20 years looking at transcranial direct current stimulation, and a lot of it's very positive. But it again is there is no easy way to get feedback other than your own subjective sense of what it's doing to you, or your friend's objective feedback about how you're behaving after you've gone through this kind of biohack. So is it any worse than popping pills and amphetamines and crystal meth for 3 days so that you can get through a really intense gaming experience? I doubt we're ever going to see a randomized study comparing those two modalities. But as a clinical tool, I do think we'll eventually see transcranial direct current stimulation come on as a therapeutic modality one day.
Now, Sean, do you see people that are normal that just want to improve their brain function, or people that are damaged that need to have it improved?
The vast majority of my practice is people who suffer from various forms of brain damage and are looking to try to normalize as much as possible and regain function.
Okay.
I would say a growing percentage of my patient population is made up of people who are normal.
Right.
And then we can argue about the definition of normal, of course, but people who generally don't have any well-defined neurological deficits but want to play at a higher level.
Right.
And so I use a multi-tiered approach to taking care of those folks that has a strong foundation of diet, sleep, and exercise as the foundation towards a better functioning brain. It's amazing how much you can get just out of normalizing things. The brain works very well whenever you are getting the right amount of sleep, the right kind of exercise, and the right kind of diet. And I call that brain optimization. But then on top of that, there are other things that can be used, nutraceuticals, for example, certain vitamins, etc. What are other things that are considered neurotropics? So they may improve brain blood flow, but they're not FDA-approved drugs. So vinpocetine might be one good example of that. And then there are a variety of other pharmacological agents on the very top of that structure that I might dip into for patients who really need extra focus and concentration. I always make very sure that whenever I'm working with a person like this, that we talk at length about side effects and about the possible risks that come with using medications, because still a lot of what we're using we don't even completely understand. There's a lot that we don't know about brain function. And so every person who's trying to gain extra function is also taking a risk that they may take a medication that they don't know how it's going to affect them in the long run. But
you mentioned the DARPA funding, the $70 million for PTSD, with the idea or the example you gave, detecting a flashback and short-circuiting it. I mean, direct current stimulation, I can see working in kind of what I would call an etch-a-sketch scenario. The brain is getting out of whack and getting messy, and you shock it, it's just like blanking it back. That kind of makes sense to me in the absence of any other real knowledge about how it works. But to get specific and zero in on a flashback or an image or a sound and cancel that out, I think we're talking about really precise multi-point electrical stimulation. And, thinking about it, the only way for me to non-invasively get to that point would be to go into the ventricular system and start zapping from there. Now, that is invasive technically, but there are ways in there without plunging through the skull, plunging through the whole brain. And I'm wondering if anybody you've heard of is starting to think about that.
Yeah, John, that's a great question. I am aware of the work that I do with Orr Md Medical has led me to quite a bit of awareness of very interesting startups out of Israel. And there is one company, I believe it's called InTouch, that is developing a non-invasive stereotactic ultrasound array that gives highly focused ultrasound beams into the brain to correct brain function. We're seeing it being used to kill brain tumors as a non-invasive scalpel. We're seeing it being used for ablation of aneurysms. So, that's really high power kind of work that needs to be done. You could imagine a helmet or some other form of, lower power array that gives a three-dimensional spread of ultrasound that may alter brain function, brain blood flow. Literally, I guess what I keep getting humbled in this industry. Just whenever I think I've kind of got a good grasp as a neurologist on all the things that are available for us, somebody comes up with a new technology or combination of other technologies that blows me out of the water in terms of what it's able to do. And so I think your ideas are very intriguing, in terms of an intraventricular approach that might get you right up against the temporal lobe and modify the memory circuits and, the amygdala.
Sure,
yeah. The amygdala is your anxiety-provoking center. It's your fight or flight network that gets activated with the amygdala. It sits right next to the lateral ventricle of the temporal horn.
Well, the whole optic projection system's back to the cortex and back to the thalamus are all accessible at multi-points. So that's exciting for, thinking about decoding images and wild stuff like that.
Sure, yeah.
Well, this device you're talking about, the ultrasound, is that to kill neurons or just inactivate them? About like the neuron police here, finding bad neurons or bad patterns and zapping them. What is their plan, or don't they know how dangerous or invasive it would be?
Yeah, the neuron police. That's awesome. To my knowledge, I think right now it's being used to kill neural tissue. Basically creating a scar through this gated array of multiple ultrasound beams that all focus on one very highly precise area, and doing it with real-time MRI at the same time to get feedback.
Yeah, today they were. Sorry.
It's impressive.
This reminded me of a device that came out today, a plastic device compatible with MRI that goes into the hippocampus for epilepsy through the cheek. Developed at Vanderbilt. They just came out with it, I saw earlier. I mean, it's a big, crude titanium, nickel, and plastic air-powered hydraulic actuated device, but it's getting into some of the stuff we're talking about, finding new ways to get into the brain.
Yeah, I think that we're going to see a whole new suite of products that hit the market within the next, 1 to 5 years that are aimed at altering brain blood flow non-invasively by stimulating nerves. There's one right now that's actually already on the market that requires insertion of a cannula through the small foramen posterior to the molars, and it actually goes up this palatine ganglion and can modulate brain blood flow. In fact, ENT doctors, Dr. Kim, are using this in the United States now to improve brain blood flow after a stroke. So it's a little bit invasive, but it may not be long before we see less invasive versions of those come out. It truly is an incredible time for the development of brain interfaced medical devices. And honestly, if you think about why, so to me though, the underlying current or the ecosystem that we're living in right now is that there's this gradient that's pushing us towards better brain function. In order to survive and thrive in today's society, you've got to have a brain that is optimized at the very least. It's so easy to fall off the economic cliff if you've got cognitive decline. That first stroke, that the first emergence of Alzheimer's, the cognitive effects of depression. We see so many folks who are living at the bottom of the socioeconomic scale because their brains are not optimized. They're being weighed down by mental illness or other forms of brain disease. And as we see this greater separation between the haves and have-nots, I think brain function is really going to be the driving factor that lifts people out of poverty or keeps them there. And so the utopian view would be, wouldn't it be nice to be able to have a commoditized way of bringing the bottom billion up cognitively to a higher level of function and existence? There are all sorts of interesting arguments that will come out of that.
On the flip side, those are the people that will get the devices if in fact the devices are any good. You have somebody with massive degeneration, suddenly their ventricles are huge, there's all that real estate available to put a big device that you or I wouldn't have, or a cerebral infarct, you have half a hemisphere of dead tissue.
Mm-hmm.
Deaf people, traumatized people might actually want a device even without those conditions and might seek, relay as such.
Yeah, I agree with you. If you even just take a condition such as normal pressure hydrocephalus, right? I've read estimates that maybe as many as 30% of patients diagnosed with Alzheimer's actually have normal pressure hydrocephalus instead. And that's depending on when you catch somebody with this condition, you may actually be able to reverse the effects of the dementia. If it goes too long, then obviously the damage is done. But really, right now, there's no real good system of making a large-scale population-based diagnosis and therapy strategy for these folks. It's very complicated to make the diagnosis. treatment is highly specialized, very complicated. So you can imagine that this is one great low-lying fruit, an area where you could make a big difference for society by having a non-invasive intracranial pressure monitor coupled with a minimally invasive cerebrospinal fluid pressure modulator to essentially reroute cerebrospinal fluid flow in a servo-gated mechanism that takes care of things better than Mother Nature is. With the right kind of focus and emphasis, you could literally take potentially millions of people out of the nursing homes and put them back into productive function. So,
it seems like pressure control goes a long way, and before you even think about putting in major implants, you need what I would call port control, because the implants themselves may disrupt flow. And
sure.
It just seems from listening to you and from looking at the literature that it's a major problem, this hydrocephalus.
Yeah.
You guys,
It's just one of many.
you guys are speaking a different language than I know. But anyways, there's a question, Sean, from a tweeter. Going back to the neuromarketing, I guess they're asking, is the analysis of tweets considered neuromarketing? Is that kind of a crazy question? I don't know.
No, I don't. Well, I don't know about the analysis of tweets. I think I would imagine that there are neuromarketers that do incorporate not only Twitter but Facebook and Google, analytics into their process, because ultimately understanding how people are thinking in large groups helps you to steer your marketing approach. So let's think of an example here. Imagine an event like the Super Bowl that can be monitored by neuromarketers, and watching trends on Twitter that give some significant signals about what people find attractive will give some feedback to neuromarketers that they can then use next year for the next Super Bowl. So they can spend the next year taking some of their discoveries and signals and testing it in the lab. So, what graphic works the best? Does the young lady in the bikini work better than the bear riding a bicycle? In activating the buy circuit, the go buy this now purchase circuit in the brain. Neuromarketing really is about getting people to drop their defenses, to get past their fear to purchase, and almost compulsively go and buy things in ways that marketing never could have accomplished before. Marketing has always been about identifying the value proposition and trying to convince clients and making the conversion and then closing the deal so that sales takes place. Neuromarketing seeks to drop the resistance, to drop the barriers, the no, right? That no, I'm not going to go and spend the money on this because it doesn't bring me value or because I don't, need it in my life. Neuromarketing is aimed at overcoming that barrier and getting people to become more susceptible to purchasing. So I guess that's a long way of saying, Twitter, I'm sure, is a goldmine for neuromarketers who are looking for those positive signals that they can use to then turn into successful sales campaigns.
Yeah, nowadays they have computers to analyze Twitter, analyze the tweets, whereas before you couldn't do that.
Yeah.
You'd have to do it by hand, one by one. But now they can analyze for trends, for different types of things happening in the tweet streams.
It seems like you still need the holy grail of a reliable physiologic yes or no answer, whether it comes from some combination of the body and even surface EEG. But it's something that willing people would wear every time they're at the computer. And every time they have a mouse click, it's interrogated for whether or not it's an approval gesture, like or dislike. But that still awaits. I don't think anybody has a reliable yes or no, thumbs up or thumbs down from the brain, at least from the surface.
Yeah, I would agree with you, John. I think there's still a lot of work that is going to be done in that arena. So much relies right now on functional MRI imaging but I think that as time goes on, we're going to see functional near-infrared spectroscopy take a bigger role. We're going to see other kinds of metabolic markers that are brain aware. But it's there's still so much discovery to be made in that arena. I agree.
This is a kind of a general question, Sean, and I kind of know the answer. You were a neurologist before computers really came into vogue, right? Around 2007.
Yeah. Well, yeah. Yeah.
Did you see it? Now, do you see a big difference between pre-digitalization neurology and post-digitalization as far as treatment and diagnosis of damage, neurological? That's probably a huge topic for another hour, but just generally.
Well, I'll give you a couple examples, John. I would say yes. The short answer is yes. There's a big difference. As a practicing physician, there's some serious changes that have taken place. One is that patients come in many ways better informed than they ever have been. They also come in much more misinformed than they ever have been. So a lot of my work has to deal with digging through people's perceptions in terms of what they think can happen. It's really challenging in patients who have had catastrophic illness and major damage that's led to brain death. So there's always been the soap opera, miracle awakening of somebody out of brain death, right? And the doctors have made the misdiagnoses, and it's always been a challenge to overcome that. But now that some patients who appear to be vegetative are actually much more aware than we thought, that has really changed our thinking about how we deal with patients who are in a chronic vegetative state.
Mm-hmm.
But I would say even just from a practical standpoint, when I go out and talk to the public now, John, I gave a talk at YMCA a little while ago to a group of just delightful 70 and 80-year-olds who had just finished their chair yoga, and they wanted to learn about brain building. And they had, the kind of questions I was getting from the audience were like, I'm anxious to go outside. And this is before I talked about anything with the brain. They wanted to know about their amygdaloid function. They want to know about their lateral prefrontal cortex was shrinking, and so this is why I'm more anxious than ever. They new terms like the hippocampus. So savvy people out there now have been reading. Norman Deutsch put out a really good book about 6 or 7 years ago that it was all about neuroplasticity, how to change your mind, change your brain. So these concepts are now in the public milieu, and there's a more highly educated patient coming to see me now, who's really asking the question. I'm saying I'm 58, having trouble sometimes remembering where I put my keys. Mom has Alzheimer's disease. I don't want to end up like her. What do I need to do today so that my hippocampus doesn't atrophy?
Right.
That's definitely a different question than I got before the commoditization of computers, before the widespread adoption of the internet.
Well, I was going to ask you. Well, I'll ask you for another time, another hangout about how you work up a patient, to pinpoint what's going on in the brain.
Sure.
But I don't want to keep it too long, Sean. Thank you very much for your time, and hopefully I have other hangouts to go over the other areas you want to cover. And thanks, John. Thanks for coming out and having some good questions.
Sure.
And He Young, I know you're quiet back there. Once you learn English better, I think you'll probably be able to participate more. Hello, He. Are you there?
Thank you. Very interesting.
Okay, good. Okay, He. Someday you're going to do a presentation on the way that what Sean was mentioning about what they did in ENT as far as neurology. So hold on, gentlemen. I'm just going to sign off. Okay. Good day, world.